Following information is presented for discussion and educational purposes only and is not intended or provided as treatment information for any specific person or behavior. If you or a loved one is having behavioral difficulties, you are encouraged to seek professional consultation as soon as possible. Ladies and gentlemen, welcome to Scottsdale, Arizona, and our episode number 3 of Ask the Behavior Doctors. We are going to talk about a couple issues that are pretty common for my patients, but not so common for children who are not, quote, special needs. We're going to talk about the use of seclusion and restraint rooms in schools, and we're going to talk about aggressive behavior. Again, pretty common issues from a lot of my patients, but definitely wanted to tape an episode about this so that we could answer some questions I get from a lot of our parents. So the first one is I saw an article recently in the Iowa City Gazette about the use of seclusion rooms in schools. And this is a lot more common than you think. In the state of Arizona, many schools have what they call seclusion rooms. These seclusion rooms are rooms, small rooms typically, that are either padded or have boards or surfaces that cannot be broken or damaged put up in these rooms. A lot of times these rooms will be very small, sometimes 4 feet by 6 feet in size. They can include padding, they can include sound suppression. Basically they're intended to be used as safety rooms for children who become a danger to themselves or to others, that literally they start to hit themselves or start to hit others and need to be put in an environment that's safe. So these rooms are used quite commonly. In the article here in Iowa City, in the first month of school in 2 districts, 125 children were secluded in this room, in this article. And basically the article just talks about that parents and grandparents say they were never informed, of the existence of such a room. Never were they told, were they informed, were they notified that such a room even existed. B, they were never notified that their children, even children without IEPs or children with no special needs, can be put into these rooms without parent consent or without parent permission. They only are legally required to notify you after your child is placed into such a room. So many parents, many grandparents in this area were surprised. They were shocked that A, they didn't know about the room, but B, that their children could be put into those rooms without their consent or without their notification. The reason I thought this article was really important was I think it highlights a lot of things that are very critical. Just so you guys know about me, I've been hired several times as a professional witness or professional consultant in litigation or due process cases with certain school districts here in Arizona. Many times I'm hired as an expert because children will be harmed, either with the use of seclusion or restraint. Children can get injured, staff can get injured, children can experience traumatic events. A lot of negative things can happen from the overuse of seclusion and restraint. So many times I'm hired as an expert to basically evaluate evidence, evaluate processes that were either followed or not followed, and figure out whether the school actually followed an appropriate process or whether they are liable basically to provide an alternative placement for certain children. Again, so I've been involved as an expert in these kind of cases several times in the past few years. So it's something I certainly have a lot of knowledge about with the use of seclusion and restraint. So basically here in the state of Arizona, schools are allowed to seclude, again, just like Iowa, in the instance of safety, basically. What they are allowed to do is put your child in a room until they are safe, up to 60 minutes without administrator approval. So if an administrator does approve, your child is basically allowed to be secluded all day. I've had children secluded for 4, 5, 6 hours during the day. And again, parents aren't required to be notified until afterwards. I've had many parents call me very upset, telling me that, hey, Johnny is telling me that he just came home today and that he was restrained and I wasn't notified by the school. Dr. Jake, what should I do? Should I call the school? What are my rights here? What should I do? Again, a very common issue, certainly something parents should be concerned about. Restraints and seclusions are absolutely, without a doubt, overused in the districts that utilize such strategies. Some districts have policies against seclusion and restraint. Many of the districts here in Arizona do not. Many of the districts that do use such procedures, again, overuse them. I think they overuse them for several reasons. Number one, it's often just the easiest thing to do to put the child in a safety room to seclude them. It's easy to do that because it doesn't require a lot of training. It doesn't require a lot of staff effort. Easier to do than to manage the problem behavior directly itself. Number two, again, it provides that guise of safety, right? You think you're keeping the child safe and keeping your staff safe. Again, what I see though is that there's not an appropriate replacement plan in place. I see that staff, especially low-trained staff, quickly become dependent upon the use of the safety room to calm the child down. I also see that children can become dependent upon the use of the safety room to be calm. The problem with this is that, again, having a safety room to keep children safe is nice in theory, but that safety room is not a very transferable stimulus. Again, if that's what a child requires to be safe and calm, you can't bring a safety room with you everywhere you go. Eventually, the child's going to have to learn how to be safe and calm without the use of a safety room. A safety room should be used only in the instance where the child's safety or staff safety is at risk. Only in those instances where the child is literally a danger to themselves or to others without the use of that safety room. Those are the only appropriate times to use a safety seclusion room. To get a child to comply, to get a child to calm down, to get a child to follow directions, to wait a child out, to let a child exhaust themselves, to let a child regain control, those are not acceptable uses of a safety and seclusion room. So I wanted to notify parents, A, that this is an issue, B, that this is an issue around the country, and C, that this is something that you can absolutely address with your school administration and with your child's team, and certainly something you should be proactive about minimizing and reducing immediately if you are notified that your child is being secluded. So a couple recommendations of what I want my parents to do if they think that a seclusion room is or is not being used is, number one, I want you to check your district's policies. I want you to look on your district website. I want you to talk to your district administration. I want you to ask them, do you have a seclusion room that you guys use? And if you do, what are your policies on the use of that seclusion room? Parents need to be aware. You need to be informed. Ignorance is certainly not a good excuse to not be proactive in this process. So inform yourself of these policies. Number two, request a meeting with your child's school administration or your child's school IEP team. If your child does have an IEP and is in special education, you should certainly request a meeting with that team as soon as possible. If your child doesn't, if they're a general education student and don't have an IEP, you can still request a meeting with your child's administration and ask them, again, what those policies are, and B, what the plan is if your child has or has not been restrained, what the plan would look like if your child were to be restrained. If they have been restrained already or have been secluded in this room, you should ask about the plan moving forward to basically address those behaviors but reduce and eliminate use of the seclusion room. I want you to make sure that seclusion is only being used for danger to self and danger to other behaviors. That should be the only criteria that gets your child entered into such a room. If that's not the criteria being used, then I want you to get some major clarification from your child's support team at the school. You need to know exactly when or when not your child will be put into such a room. You need to know what the entry criteria are into that, and you need to know the exit criteria. So you need to know exactly what will get your child put into that room and what behavior is required to consistently get out of the seclusion room. The biggest recommendation I have is make sure your child has an FBA. That stands for a Functional Behavior Assessment. Make sure your child has an FBA if they are ever being put into a seclusion room. The reason this is required is because it's a federal legal mandate that When behaviors are involved, especially behaviors serious enough to get your child put into a seclusion room, that they must have a functional behavioral assessment in place that does two things: that has a plan to increase behavioral deficits, things your child needs more of, and a plan to decrease problem behaviors, behaviors your child does too much of. If your child does not have an adequate FBA in place, what that tells me is that the staff does not have a viable, comprehensive plan they're following to increase and decrease your child's behaviors accordingly. That basically tells me that the staff is haphazardly kind of trying to manage your child's behavior on accident. Remember, this is your child's right to have a functional behavioral assessment. This is part of their independent educational evaluation process. Make sure your child has an adequate FBA. If you're not sure whether the FBA is really adequate, you should contact a professional, seek professional consultation as soon as possible from someone like me with a BCBA, someone who is a behavior specialist, and have them look at and evaluate the plan. The plan should be written in a way that parents can easily understand what are the target behaviors, what rates were those target behaviors occurring at a baseline rate, what the plan is to increase adaptive behaviors and decrease maladaptive behaviors. If you can't see those things clearly defined and listed in your child's FBA, then you probably either need to request a new FBA or speak to your child's team and seek further clarification on the existing FBA. I want you to communicate frequently with your child's team and make sure that you're informed and that you're very proactive in this process of every time your child is put into the seclusion room. You should be notified immediately, meaning at least my perspective is within 90 minutes of the episode occurring. You should be notified of every instance, and you should keep track of the data yourselves. You definitely want to make sure that the frequency and duration of your child going into the seclusion room is decreasing. If that is not decreasing, at least within a month to 3 months, you need to be concerned and you need to seek professional consultation. Again, either from a behavior specialist like myself or from someone who is an advocate or specialist in the IEP process. Again, parents, schools should have an adequate plan in place to reduce and eliminate the use of that seclusion room with your child. If that reduction or elimination of that is not occurring within 1 to 3 months, that's definitely a red flag that the plan they have in place is probably not adequate. And now to our parent question of the week. A very common variation of this question is, Jake, what can I do about my child's hitting behaviors? What can I do about their aggression behaviors, especially with their siblings? How can I possibly control or manage my child's aggression behaviors with their siblings? What can I do about my kid hitting other kids? This is a serious issue. Schools have very little tolerance for physical aggression. It's really sad, but I get calls as a professional of children who are 4, 5, and 6 getting charged with assault at this age for hitting other kids. It sounds silly to even say, but it does happen. Some parents are definitely, litigation happy and literally will try and press assault charges on 4, 5, and 6-year-old kids. This certainly happens with older kids too. Aggression is a serious problem. Again, the schools are certainly showing poor accommodation of aggression behaviors, very poor tolerance for such behaviors. But it's a difficult behavior to accommodate effectively. It looks surprising, it looks shocking. It typically produces a big reaction from the other person, and it's not very socially acceptable in very many environments. So I certainly understand parents' ideal of wanting to decrease the behavior as soon as possible. So many children I see that are overly aggressive are using that behavior to meet a functional need. So my first answer to this question is that you can't prescribe a specific treatment based on what's called topography alone. Topography of a behavior is what it looks like, sounds like, and feels like. You can't say how to treat a behavior just based upon its topography. You got to know its function in addition to that. So some kids can be aggressive for many different reasons. I've seen many children that can be aggressive for attention. that is literally their way to show you that they want to be close with you, they want attention, and sometimes they want to seek, what's called negative attention. They'll seek it in any way they know how to. So they can be overly aggressive in those moments when trying to get that attention from others. Other children can be aggressive to get out of things. So when any kind of task demands or any kind of demand is placed that they don't want to follow, they can be aggressive to try and get out of that. Kids can be aggressive to try and get kids away from them. Kids can be aggressive to try and get access to preferred items. Kids can be aggressive for many functional reasons. So that's why it's hard to say exactly how to treat aggression in any given moment, because you don't know why the child's being aggressive. So the thing that's really nice about diagnosing why the functional reason why your child's being aggressive is that we as behavior specialists can do something what's called a functional analysis. So here in our facility, we have lots of rooms and lots of special places where we can do an evaluation and press buttons to try and turn the behavior strategically on and off. And once we're able to turn that behavior on and off in a strategic way, we can figure out what's triggering and what's maintaining that behavior functionally. So let's assume that a lot of children are aggressive for one of two reasons, either attention or escape. So based off that function is how we would kind of prescribe that a treatment. So let's say a child's doing aggression for attention. Let's say they frequently come up to a parent and hit them, or frequently go up to a sibling and hit them. What you would want to do, number one, is increase your child's skills of requesting attention appropriately. Think about it, behavior is communication. If your child has really good verbal communication skills, they won't need their behavior as much to communicate those needs. So you'd want to teach your child those replacement skills of just asking for attention. Hey, will you play with me? Or hey, can I have that toy? Or hey, can you give me some attention right now? Can we hang out for a few minutes? If your child has those skills to do that, again, they won't need to rely on that behavior as much. Let's say it's attention for escape. So let's say you give your child a demand and then they hit you or they hit someone else, or they don't want to do something, they want to get out of something, and then they become aggressive. Well, the best way to do that is A, don't let the aggression work. Make your child's words or make some other appropriate functional response work. So if your child doesn't speak or can't speak yet, then your child needs to do some kind of appropriate behavior to show you that they don't want to do that, or to communicate that they'd like to have options of something else to do. So again, you want to make simpler, you want to make more appropriate behavior work better than the aggression, and you don't want to allow the aggression to work. So the worst thing you can do is allow your child to get out of that demand for being aggressive. So again, you're trying to replace that with an appropriate, functionally equivalent behavior. So a couple recommendations I have for parents who have aggressive children or children who like that physical engagement with others. I want you to allow a proper and healthy outlet for children who have a natural inclination for aggressive. Myself, I've always been a big guy. I was a young boy. I was naturally aggressive. I used to be aggressive with toys, items, and I was playfully aggressive. My mom got me involved in sports and a lot of physical activities very early on. It was a good outlet for me. So if your child shows a natural penchant for physical, aggressive, playful activities, use that motivation to your advantage and get them involved in activities that naturally use those physical properties. There's this concept in behavior analysis called learning channels. It's basically the information your child learns through what's called inputs and outputs. It's the inputs that your child seeks to learn from, and those can be visual, those can be auditory, those can be kinesthetic, those touch kind of inputs, and then outputs. What does your child do to communicate or output information? So a lot of children show a heavy preference for physical input and outputs. Those are their preferred learning channels. And if that's what they're saying, then like I said, preventatively getting them involved in such an activity could really help reduce inappropriate aggression at other times. I want you to avoid major triggers for aggression and plan accordingly. So if you tell me that Johnny and his brother get aggressive with each other frequently, especially when they're alone, well then my first advice to you is, until we can get some replacement skills in place, what I want you to do is I want you to not let Johnny and his brother be alone unneedingly or unnecessarily. I want you to reduce the amount of exposure they have to each other alone until, like I said, you can get some more replacement behaviors in place. If anything, in a moment where you can't necessarily leave them alone with each other, I would probably pick the more compliant one and have that child be close to you so that if the other child does try and be aggressive with them, you can at least see that, block it, and prevent it as much as possible. I want you to practice replacement skills and routines with your child. So I want you to practice what your child should do when they get mad. Literally, you should have a plan in place, a routine. All right, Johnny, when you get upset, this is what you're gonna do. You're gonna be quiet. You're gonna take a walk to this special part of the house or to this special chair. You're gonna sit there and you're gonna take 3 deep breaths. You're then gonna come talk to mom and tell me why you're mad. You're gonna tell me why you're upset. Some kind of plan or routine. Try to make the plan transferable to multiple environments. Try to make it simple enough to do in 3 steps or less. And definitely make it easy enough that your child can repeat the plan to you. What you want is a plan that's easy, a plan that's quick, and a plan that will transfer to multiple environments. But again, if you have a plan in place that you practice, your child will have that replacement skill in their repertoire and will be more likely to use it. I want you to reward and reinforce calm, hands-to-self behavior. Your child will make it a big deal when you do. So think about incompatible behaviors with aggression. Typically, if your child is calm, keeps their hands to themselves or keeps their hands by their side, it's really hard to hit or become aggressive with others. So if you focus on replacement behaviors and focus on especially what's called incompatible behaviors, and you reward and reinforce that, like, hey, Johnny, when I see you with calm hands or your hands together, or if I see you keep your hands to yourself, you're gonna earn that really awesome reward, or you're gonna earn points in a token system, or however you wanna reward it. But again, if you make the behavior valuable and you stress exactly the behavior you want instead of aggression, your child's much more likely to give it to you in multiple environments. If your child does become aggressive, especially with their sibling, I just want you to response block it. I want you to give it as little attention as possible. And then I want you to model the calm, appropriate demeanor. Remember, you set the tone as the instructor in that environment. If you're calm, cool, and collected, and you model that response and that de-escalation response for your child, they're much more likely to model and emulate that. I want you to coach your kid through those difficult moments in vivo, in the moment. Remember, if your kid is 3, 4, 5 years old, they probably don't have the skills yet to manage frustration. They might get angry and they just lash out. They need you to help them problem solve sometimes, and doing that in the moment, not only practicing before the moment, but doing that in the moment together can help your child really learn how and when to apply those skills accordingly. What I really want you to emphasize is that keeping your hands to yourself and that calm, collected, appropriate behavior is the best way to earn access to the things your kid wants. That needs to be one of the most important behaviors. If I were to sit down and talk to your child and say, what are your rules, or what are the rules in your house? One of the top 3 rules needs to be keep your hands to yourself, no hitting. So remember, you want to phrase that rule in the affirmative, you want to phrase it in the positive, you want to tell your child what to do, not necessarily not what not to do. And you want to really make big rewards or access to the really important things contingent upon doing those important behaviors. So let's say, if Johnny has a problem of hitting his brother or sister multiple times a day, let's say, all right, Johnny, if you can go the next 2 hours keeping your hands to yourself, and I can see you're really making good choices with that, I'll let you earn, special access to video games. I'll let you earn 30 minutes on the computer. I'll let you earn, an hour on the bike at the end of the day. You want to make those reward times at first really short, meaning only an hour at a time, and then give that reward quickly. And the rule is, the shorter the time, the lower the bar needs to be for the younger the child. So if the child's 3, 4, 5, you probably need to make that contingency about an hour long. If they're 5, 6, 7, or 8, you can make that 2 to 3 hours long. If you do it by a whole day, it'd be really difficult. So if you tell Johnny, if you keep your hands to yourself all day, you'll get this really awesome prize, it's not immediate enough, and it's not going to be powerful enough for a young child. So remember, model the way, give your child appropriate replacement behaviors, practice those replacement behaviors, make the behaviors you want important, and reward those and reinforce those frequently. Ladies and gentlemen, that brings us to the end for today. Please continue to submit your questions to us at info@scottsdalepbs.com. We want to thank our photographer, who's behind the camera today, Mr. Philip Carnevale. His website is www.philipcarnevalephotography.com. Thank you again, ladies and gentlemen, for submitting your questions to us and for joining us here at Scottsdale Pediatric Behavioral Services and Ask the Behavior Doctors.